Hello, everyone. In this brief presentation, I will be reviewing the JRCRT standards and specifically just making you aware of how the JRCRT standards apply to the radiography program at Santa Barbara City College. This is Professor Fonseca. So to start off with, on this very first slide, there's a clickable link that takes you to the JRCRT standards. The standards of 2021 are about 55 pages in length. And so the program is required to adhere to these standards. We have an upcoming site visit in September in which all of you will be participating in. So we're just making you aware of the standards. So just so you're aware, our accreditation protects your career because there's guidelines and markers in there, including the supervision requirements that are in place. So when you go to the clinical environment, you're not left alone as you continue to learn and grow as a student radiologic technologist. We want to make sure that when we visit you, if there's any concerns, and we visit either on a weekly or bi-weekly basis, that those concerns are addressed immediately. We educate you on the radiation safety aspects of the program as far as you wearing a dosimeter badge and also explaining the areas in which you can protect yourself. So accreditation is essentially a layer of protection for all of you. We make sure you don't work on holidays. So all the rules and regulations that are required for the accreditation, they're enforced with your protection in mind. So what exactly is JRCRT accreditation? Essentially, it's the gold standard. It allows you to sit for the national board exam for the ART, and it essentially it provides the program with rules and regulations. So for example, the supervision element, where you have to be supervised for all portables, for all fluoroscopy procedures, and for all OR procedures, regardless of your competency status. And in the orientation, we will be going over competencies and how to obtain competencies. But essentially, it's the gateway of opportunity for you to take your national board exam so you can work in anywhere in the nation that you choose to. So it helps you reach that standard of excellence and helps the program maintain a continuous improvement focus on mind. So for the clinical compliance piece, there's a 1 student to 1 technologist ratio. So meaning we can't have multiple students with 1 technologist supervising because we would be out of compliance. And that is to help protect and make you, put you in the best position to be most successful when you're learning, and it protects the patient as well. So what's the difference? Direct supervision means they're physically present in the room, ready to jump in case there's something that needs to happen. The tech is evaluating the situation to see whether or not you're able to complete the exam without any intervention. And they're readily available for you. Once you sign off and get a competency, indirect supervision occurs. And that means that they are not too far away and can still jump in, but they're not immediately in the room. So they can be in the hallway. So they're still within eyesight of you. So remember, as a student technologist, when you first start the clinical, you're going to have direct supervision. And as your skills improve, you will migrate to indirect supervision. However, for repeat exams, portables, fluoro, and OR procedures, at all times, you must have direct supervision regardless of your competency level. So the competency checkbook, what exactly is that? Well, once you sign off and you receive a competency of a certain procedure, then you can have indirect supervision. So for example, if you get signed off on a 2-view chest exam, then the technologist could be in the hallway just looking through the exam room window and just monitoring how well you're performing the procedure, but they don't need to be inside the room. And that's what the difference lies with that. Of course, if you have to repeat an exam, the technologist must shift to direct supervision. What is something that's pointed out in the standards to protect you? A golden cardinal rule, and you'll learn this in the program, is to maintain a radiation exposure as low as reasonably achievable and to protect yourself from said exposure. Time, distance, and shielding are the cardinal principles. And you'll learn this throughout the program, specifically in the radiation protection class, but also in the lab and positioning, and also in Professor Scolari's class, where he goes into this concept a little further. But essentially, these are strategies to protect you because you are working as a healthcare worker being exposed to radiation. So there's areas of protection that you employ as a student technologist, and then ultimately when you're in your career as a radiologic technologist. We do have dosimetry badges that you have to wear at all times for the labs and also at the clinical sites. If you cannot bring your badge, you cannot go to clinical and you must make up that time. And we do have a makeup policy, which you will be introduced to. Just know this, you will not reach those limits because you're going to be employing time, distance, and shielding, and you're not holding patients. You're not doing anything to put yourself in harm's way to reach these limits. And if you leave your radiation badge on the shield, you just report that incident and we document that. Pregnancy policy. This is a optional choice. Female students are not required to report. We encourage you to report, and there's a process in the policies and procedures handbook that you will be receiving that will outline this process or this pregnancy policy, like the steps to declare that you're pregnant. So this is a voluntary process. You have a couple of different options. You can continue the program without any modifications of your schedule. You can voluntarily withdraw, step back, and then come back. And everything has to be in writing. So this is a written process. The policy goes into great depth of what the steps are. And we're here to support you through this if this is indeed a situation that does come up for you. So we do have a due process that is followed, and we want to make sure that you're supported. I know we had a previous orientation video that discussed this, but we want to make sure that you are aware of the due process and that the conflict or dispute gets resolved here at the school prior to any enforcement or need to pursue any accreditation reporting process. So here's a detailed breakdown of how to resolve. And these are estimated timeframes as far as the response to any set conflict. We do our best to resolve this in a timely manner, but these are guidelines for you. So if you have an issue in the clinical side, you talk to the clinical preceptor and or the clinical supervisor. The clinical supervisor is somebody who is affiliated and works for the college and visits you on a weekly or bi-weekly basis. In conjunction with those two individuals, if it escalates further, clinical coordinator, and that's the capacity I currently serve as of March 16th. Then it goes from that individual, which is myself, to the program director, which is Bruce Oda currently, then our dean, and then there's a dean of student affairs if it reaches that level. Essentially, we try to informally handle any concerns you have in a timely manner before any of it elevates to the JRCRT. If you do need to contact the JRCRT as far as any concerns, we want to make you aware of Standard 1.5 that you can submit allegations directly to the JRCRT. Here is the contact information. There's their email, there's the website, and the first link will take you to the standards so you can see all the standards of the program. And we, as the JRCRT indicates, you want to attempt to resolve any of the complaints that you have directly with us before you move to this direction. So there is an accountability loop as far as we make sure that we are meeting the JRCRT standards. We have clinical rules in place to protect you. We collect program effectiveness data, so it's our success benchmarks. Last year, we had a perfect examination pass rate, and obviously the goal is to be at that level each year. And the reality is we have a grievance process in place in case there are concerns you have. We do our best to support you throughout the journey, throughout your 2-year enrollment in the program, please talk to us if you have any questions or concerns. We're here to help you with that. And that concludes this video. I look forward to meeting you at orientation. I hope this video was informative. Please let me know if you have any questions during orientation. Thank you.